This is orthopedics. It's a science of outcomes. Because the only thing that matters in orthopedic surgery is the outcome. What happens as a result.
This is a forever thing. I'm forever free of pain with the new knee.
Well, I think one thing that's nice is that we still are a community hospital, so you get that community hospital feel. You don't have that large academic center where the significance of the individual may be lost. Here, everybody matters. Every patient matters. We can deliver a high level of care in this type of setting.
And the only result that matters is how long it takes for you to get your life back. Because that's why people see orthopedic surgeons. They can't bend, they can't walk, they can't turn, they can't carry, they can't lift.
I think the best thing for a patient is to make their life easy. They come in, they're hurting, they have pain, they're anxious, and they really don't know what to expect. And I feel that the hospital's done a phenomenal job of allaying their fears, showing them what to expect, what they'll have before and after surgery.
I met a patient who was in a wheelchair, and she was in excruciating pain from bilateral hip and bilateral knee arthritis. And now she is walking and enjoying her life again. She's being a grandmother. She's going to see soccer games and caring for her little grandchildren.
That's why they come to PBMC Health. Because here, the only thing that matters about orthopedic surgery is the outcome.
Recently, I've had a 6-year-old girl who had a displaced fracture in her elbow. I was able to fix her elbow here and see her get back to full range of motion with her arm. You know, what was really touching was the day that I sent her back to gym and she was able to start doing cartwheels again. She was very happy about that. Gave me a big hug, and it was very nice.
At PBMC Health, there are 10 orthopedic surgeons who are concerned more than anything else with outcomes. There's an entire team of doctors, medical professionals, and rehabilitation specialists who back them up. They all have one objective: to get your life back.
They're not working on somebody who is commuting from hours and hours away. In general, they're working on the people in the neighborhood. It could be their 3rd grade teacher. It could be dad's accountant. It could be mom's bridge partner. That whole attitude just carries over right from start to finish.
And that personal touch is very valuable with a patient getting better and getting stronger.
Because that's your outcome. It's the only reason you ever see an orthopedic surgeon, and it's the only reason you go back to say thank you.
Well, I think one of the great things that the hospital has done is they have an annual picnic with their post-op total joint patients. And it's a great time to see people that once came in with a walker and could barely walk to all of a sudden they're dancing with their partners on the dance floor and just enjoying a great afternoon together. And it's just phenomenal to see someone turn their life around.
So I have one patient, I think she said it was Mount Rainier. She was hiking with both of her new knees or so, and she was very happy. And even comes back for follow-up just for one day a year to tell me about her adventures.
Because you'll have your life back in ways you've forgotten all about. Because you'll develop a whole new ability to bend, to walk, turn, carry, and lift.
There was a lady who came to my office who couldn't walk. She was in a wheelchair and she was on oxygen. About a year later, she came to the office, no wheelchair, no oxygen, wearing a dress. It looked like a totally different person. The fact that her hips were so bad made her oxygen consumption go up so high that she actually required oxygen to function, and that once we got rid of the bad hips, she really didn't need it anymore.
You can see patients come into your office in substantial amounts of pain, and you can come up with a comprehensive plan of care, including surgical intervention, that will allow you to radically change their life.
Because your life will come back to what it was, to what you remember, to what you hoped, but never believed you'd ever see again.
There isn't a single hospital any place in the world that has better outcomes. If you look at infection rates, readmissions to the hospitals, returns to the operating room, there is no hospital that has better outcomes.
I felt so terrible last year. I had achieved a couple of goals of, doing things on the beach, and I couldn't go with them because I couldn't walk in that sand. So now I can go with them, and as my granddaughter said, bring the picnic lunch, Grandma. That's what grandmas do.
At PBMC Health Orthopedics, we call that an outcome.